On November 2nd, 1848, a German doctor named Karl Heinrich August von Bureau was just opening up his private medical practice in East Prussia when a teenage boy burst in through the doors looking totally frantic. Before the doctor could ask any questions, the teenager blurted out that another boy in town needed his help right now. When the doctor asked, what does the boy need? The teenager would say, well, the boy is honking like a goose. For a second, Dr. von Bureau thought this might be a joke, but then he saw the look on the teenager's face, and he could tell he was very upset and very serious. So the doctor grabbed his bag and he ran outside with the teenager, and they hailed a horse and carriage, and they told the driver to hurry up. When Dr. von Bureau and this teenager arrived at the honking boy's house, the honking boy's mother came running outside looking totally flustered, and she flagged down the doctor and then brought him inside her house. And as she led the doctor through the home towards her son's bedroom, she explained what was going on. She said her 12-year-old son had been outside playing with his friends when suddenly he had developed this really intense coughing fit, kind of out of nowhere. And then finally, when the coughing stopped and the boy tried to breathe in, his throat made this horrible honking sound. And so her boy had come in the house honking with every breath, and so kind of in a panic, the mother had opened up her son's mouth and looked inside, but she hadn't seen anything, and she knew her son was not sick. There were no other symptoms really at all that were concerning about her son. It was just that he was honking. Now, for a while, the mother thought this would just kind of clear up, that maybe it was just kind of some byproduct of coughing really, really hard. But now it had been 18 hours and the boy was still honking with nearly every breath, which is why she had finally told the teen to go get the doctor. When the mother let Dr. von Bureau into her son's bedroom and he got a look at the honking boy, he couldn't believe how terrible the boy looked. His face was all swollen and kind of bluish, and he was sweating profusely, and when the doctor watched him try to breathe in, not only did he honk, but also very clearly this boy was really struggling just to breathe. So it was more than the sound, it looked like he was suffocating. And so the doctor rushed over to the boy and told him to open up his mouth. The boy did, and the doctor looked into his mouth, but there was nothing he could see that was blocking his airway. And so the doctor just put his finger into this boy's mouth and he reached down inside, and suddenly he felt something lodged in the boy's throat that was small and hard, and he couldn't quite grab it. So he grabbed his forceps, which are kind of like big tweezers, and he reached back into the boy's mouth and he tried to grab this object that was clearly obstructing his throat, but the object was too slippery and the doctor could not pull it out. And so the doctor is looking at this boy who's obviously struggling to breathe, and he's thinking to himself, if I don't get in there and get this obstruction out, this kid is going to die. And so the doctor made a decision right then and there to perform an emergency tracheotomy, which is a surgery where you basically cut a hole in someone's neck in order to create a hole in their throat to let air go in. But in this case, the doctor was just opening up his throat to try to get to this object. And so the doctor pulled out his scalpel and he performed the tracheotomy on this boy. He opened up his throat, and when he looked inside the hole into this boy's throat, he saw the obstruction. It was like this pink, small, hard object. And so the doctor just reached in, scooped it with his finger, and pulled it out. And right away, the boy could breathe again. He was not honking anymore. It was obvious that this fixed the problem, but the doctor and the mother are just looking at this object in the doctor's hand, having no idea how to react to this because it made no sense. The object that was trapped in this boy's throat that was making him honk like a goose was a literal goose's larynx. The larynx is a hollow tube in your throat that helps you make sound. In humans, we call it the voice box. And right before this boy began honking, he was playing a game with his friends that involved taking recently severed goosenecks and blowing through them like they were trumpets. And at some point, as this boy was doing it, he began to cough for some reason, and on the inhale, during one of these coughing fits, he had this gooseneck in front of his mouth, and so when he inhaled suddenly, he inhaled the goose larynx. And so that was why he sounded like a goose. He literally had a goose's voice box in his throat. Luckily, the honking boy would make a full recovery. On the afternoon of February 1st, 2013, a retired Army veteran named Robert Smith limped his way into the emergency room at the Veterans Affairs Medical Center in Washington, D.C. Robert checked in at the triage desk, but then instead of sitting down with the rest of the patients who were waiting, he leaned up against the wall and just grimaced. Robert was in his late 60s, and up until just a few days ago, he felt like he was in the best health he had been in since leaving the service. Robert had gotten a kidney transplant a year and a half earlier, and after getting that operation, he really wanted to make sure he stayed healthy, and so he had been going on regular walks and eating healthy, and so really he was doing great. But a few days ago, Robert had noticed this throbbing pain in his right hip that was shooting pain all the way down his right leg. And he assumed, this had to be from maybe overdoing it on one of his walks. But the pain had continued to get worse and worse over the last few days. And so that was why he was finally here at the hospital. A nurse eventually called Robert's name, and so Robert, he came off the wall and hobbled over to her, and she led him down a hallway into an exam room. Once they got inside the room, the nurse would take Robert's vitals, which were all normal, and then after doing that, she said she was going to go out and get the doctor. A couple minutes later, the doctor walked into the room, and she reviewed Robert's chart and talked to Robert about his symptoms, and then afterwards, she concluded that very likely what Robert had was something called sciatica. Sciatica is pain caused by pressure on the sciatic nerve, which travels from the lower back down each leg. And while sciatica is definitely very uncomfortable and very painful, it's not usually a big deal, and it typically clears up on its own without treatment. And so the doctor told Robert that he should just go pick up some ibuprofen, so over-the-counter pain medication, and take that every couple of hours and just wait for this thing to pass, and then he'd be fine. And so Robert was totally relieved. He thanked the doctor, he thanked the nurse, and then he left and headed back to his home. But despite doing what the doctor said and taking pain meds and just kind of taking it easy, the pain in Robert's leg did not go away. And then on the morning of February 4th, so 3 days after Robert's trip to the ER, he woke up and not only was his right hip and leg still sore, but now when he tried to stand up, he couldn't put any weight on his right leg. It just felt too weak and it was kind of tingly. Something just felt off about it. And also Robert felt very nauseous. And so Robert told himself that, maybe what was going on here is he was taking too much ibuprofen and it was upsetting his stomach, and maybe it was also affecting his leg negatively or something. He didn't know. And so that day he just sat on the couch and watched TV trying to tell himself that he was okay. It's just sciatica, take a little less pain meds and you'll be okay. But that didn't work, because the next day when he woke up, he was in even worse shape. Now, he not only had this pain and weakness in his right leg, and he had nausea still, but also he now had this new pain in his abdomen that was located right around where the scar was from his kidney transplant, and Robert was also starting to spike a fever. And fevers in transplant patients are a really big deal, because a fever in a transplant patient could mean an infection. People who get transplants are then given medication that keep their bodies from rejecting their new organ or organs. This medication works by basically suppressing that person's immune system. This prevents the body from mistakenly attacking the new organ, but it also means that if their body gets a real infection, they will have a really hard time fighting it off, because again, this medicine is basically stopping the immune system. And so when Robert saw he had a fever in conjunction with these other symptoms that were not going away, he knew he had to go back to the hospital, because obviously this was not just sciatica. Robert was too sick and weak to drive himself to the hospital, so he asked his neighbor to drive him, and as they were driving to the hospital, Robert basically sat in the passenger seat rocking back and forth, not saying anything because he was so uncomfortable, and the neighbor, the whole time they're driving, they just kept looking over at Robert, because not only did Robert look totally miserable, but also Robert was sweating profusely, like so much so that it looked like he had just sprinted a 5K. I mean, he was drenched in sweat. And so the neighbors looking at him thinking like, what's wrong with this guy? Finally, the neighbor arrived at the hospital, and Robert, he managed to get out on his own, and he thanked the neighbor, and then Robert hobbled his way back through the doors into the ER. And then a few minutes later, Robert was in an exam room, and his doctor walked in, and she took one look at him and saw how horrible he looked, and without any hesitation, she said, "You're getting admitted right now." It was clear to Robert's doctors that he had some kind of virus or infection that his body was trying and failing to fight off. When they tested his blood, they saw his white blood cell count was elevated, which is a sign that the body's immune system is launching some kind of a response. But the doctors didn't know what his immune system was responding to. Even though Robert had this acute pain in his abdomen around the site of the kidney transplant, his kidneys seemed to be working just fine. And so whatever was going on with him didn't seem to be linked to his transplant. The profuse sweating did seem pretty odd, but considering Robert had a really high fever, it wasn't totally inexplicable. So basically, Robert's symptoms were weird, but kind of generic. They didn't tell the doctors specifically what was wrong with him, they just knew something was wrong. So they just hooked Robert up to an IV and began administering a broad-spectrum antibiotic, which is something that treats a whole variety of different infections. And then after that, the doctors just began testing Robert over and over and over again for all these different things that could be the cause for his illness. But every test they ran came back negative. And at the same time, over the couple of weeks that they ran all these tests, Robert just kept getting sicker and sicker and sicker. His fever wasn't going away, he was still sweating profusely, his blood pressure was all over the map, and he had even begun drooling almost uncontrollably to the point where he didn't even speak because he was so embarrassed about it. But to the doctors, the scariest symptom that Robert was now showing 2 weeks into staying at the hospital was he was starting to act really confused. Like he didn't know where he was, he didn't know why he was there. And so that told the doctors that, whatever his body was fighting, it had made its way up into his brain. And so the doctors knew, Robert did not have much time left, but they had tried every test they could think of, and Robert had tested negative for all of them. And so, as kind of like a Hail Mary, because they had nothing to lose, the medical staff decided to just start testing Robert for basically completely random diseases that he almost certainly did not have. But basically, if any of these illnesses had a symptom that Robert had, they would test him for it. And all these tests came back negative, except for one. On February 22nd, so 17 days after Robert had been admitted to the hospital, this test came back positive, and when the doctors saw what he was testing positive for, they immediately assumed this has to be a mistake. There is no way he has that. However, the only way to truly confirm that diagnosis was to literally cut into Robert's brain, which would kill him. And so obviously they were not going to do that. So the doctors basically just had to take this diagnosis at face value, and they tried giving various medications to Robert, but it was obvious none of them were working. And so the doctors felt like there wasn't much they could do, and they just began focusing instead on keeping Robert comfortable. And then finally, on February 27th, so 22 days into Robert's stay at the hospital, he would die from this mystery illness. During Robert's autopsy, the medical examiner was able to perform that test that doctors could not perform on him when he was alive, and that was to cut into his brain. And when the doctor cut into his brain, he saw very clearly, without a shadow of a doubt, that yes, Robert really was positive for that very, very rare virus, and it absolutely is the thing that killed him. But this was not the end of the case, because the virus that killed Robert was not just rare, it was also highly contagious, which meant the doctors needed to figure out how Robert got this virus to protect other people from getting it too. But the staff at this hospital knew they were not equipped to lead this investigation, and so they handed the case over to the Centers for Disease Control, or the CDC, which is the world's leading disease tracking agency. Investigators for the CDC began looking into Robert's case a couple of days later. They sifted through the days and the weeks leading up to Robert's hospitalization in an effort to try to retrace Robert's footsteps to figure out what made him sick. Now, they didn't have any leads. The only thing they agreed on was that very likely, even though Robert had that pain around his scar where the transplant was, that very likely the transplant did not have to do with whatever killed him, because Robert's kidney had been working fine and his transplant had happened 17 months earlier, and typically complications from transplants will happen much sooner. And so they basically had ruled the transplant out as being the cause. But one of the CDC investigators decided to look into the transplant file anyways, just to see if maybe something got missed, or if maybe there was some detail about the donor that was relevant to what happened to Robert. And so this investigator got the file and began going through it. Robert Stoner's name was William Edward Small, and at the time of his death, he was 20 years old and serving in the Air Force. Now, none of that stood out to the CDC investigator, but William's cause of death definitely did. Even though it really did not appear to have a connection to Robert, it was just so weird and unexpected. The CDC investigator would read that back in September of 2011, William was out fishing in the Gulf of Mexico, and he caught a fish, and he ate that fish, and it gave him something called ciguatera poisoning. Ciguatera poisoning is something you get when you eat a fish that contains microalgae toxins. And so William, he ate this fish that was contaminated, and not long after that, he had died. But when the CDC investigator read through all of William's symptoms before he died, they basically exactly lined up with all of Robert's symptoms. William had developed pain and weakness in his extremities. He developed a very high fever. He became nauseous. He also lost the ability to swallow, and then he became totally confused and then died. And so when the CDC investigator saw this incredible coincidence, she knew she was onto something, but first she would need more information about William. And so very quickly, the CDC got in touch with William's family, and they asked them all these questions about William. And finally, after hearing the answers from the family, the CDC finally figured out what actually happened to Robert and what actually happened to William. It would turn out William was not just a fisherman, he was also a hunter and a trapper. And he had a very specific way he would go about training his hunting dogs. He would capture wild raccoons and use them as live bait to train his hunting dogs how to hunt. Now, William was always very cautious with these wild raccoons, but in the year and a half leading up to his death, he was bit 2 different times by raccoons. And it was one of those 2 raccoon bites, not some toxic fish in the Gulf of Mexico, that killed William and killed Robert. William did not die from ciguatera poisoning. He died from rabies, and the rabies virus that was in his kidney was still present when it was taken out of his dead body and transplanted into Robert's body. And so that was how Robert got rabies. Rabies can look like the common flu at first. People feel achy and nauseous, they get fevers, their stomach starts to hurt. Some people affected by rabies will drool uncontrollably, like Robert, or they'll lose the ability to swallow, like William. But for everybody who contracts rabies and who does not get a vaccine right away, because a vaccine does stop rabies in the early stage, so if you don't do that, everybody dies. That's what rabies does to you. It kills you. Now, you'd think, maybe we should be testing organs for rabies before they get transplanted, but you got to remember that rabies is so rare. Only 1 or 2 people a year in the entire United States will die from rabies. And so it's just not something doctors are going to screen for, because the percentage chance that they could have rabies is basically 0. Ultimately, Robert was not the only person who received an organ transplant from William. There were 3 other people that received his organs. Luckily, though, the CDC was able to track those 3 people down, and all of them were totally healthy and not showing any signs of rabies, so either they didn't have it or they were super early stage, which meant they were eligible for the rabies vaccine. They all got the vaccine, and they lived happily ever after. On February 28, 1995, 20-year-old Kim Antonakis sat in front of her mirror getting ready to go out for the night in Brooklyn, New York. Kim had long, curly brown hair that matched her brown eyes, which were actually the only part of her appearance that she was never happy with. So she put on her favorite pair of gold earrings and leaned in close to the mirror to add the finishing touch, her blue contact lenses. Putting in those blue contacts made Kim feel like a different person. By day, she was a reserved college student who studied, did well in school, and worked hard at her part-time job. But by night, she was free and a bit wild, and men could not keep their eyes off of her or her blue eyes. Kim took a final look in the mirror and then walked through her ground floor apartment, a place most people her age in Brooklyn would have been jealous of. It had 2 bedrooms, hardwood floors, and a private 2-car garage right across the street. Now, Kim alone could never have afforded this place, but luckily, her dad covered most of the rent. Kim looked over and saw her friends, April Deedley and Josh Torres, sitting on the couch watching TV. And April looked up and told Kim how pretty she looked and told Kim to go out and have a great time. April and Josh had been staying at Kim's place with their 2-year-old son for the last couple of weeks while the floors got refinished in their apartment. Kim loved getting to spend time with April and her little boy, but really, she was glad that Josh was there. Having a strong man in the apartment made her feel safer, and for most of the past month, Kim had not felt safe at all. In early January of that year, Kim had met a guy named Vladek who actually went by the nickname Psycho. He was Russian, he was very good looking, and he was a bit older than Kim. At first, Kim thought Psycho was one of those ironic nicknames, like when a really big guy gets called Tiny or something, because Psycho seemed like a lot of fun. He was laid back and really nice when they had met, but recently, that had all changed. Kim said goodnight to April and Josh, she put her coat on, and walked outside. It was about 40 degrees Fahrenheit, which wasn't bad for a New York winter, but still, Kim felt a bit cold. She glanced up and down the street, looking for strange cars parked nearby or headlights coming down the road. Psycho had really begun to live up to his nickname starting about a month before, when Kim and Psycho had taken a quick trip to Florida together. Now, Kim had thought this getaway was just kind of a casual chance to go hit the beach and have some fun, but apparently Psycho saw things very differently. Because when they got back to New York, he got Kim's name tattooed on his leg, and then he proposed to her. Kim had broken things off right then. A marriage proposal was way too fast and way too serious for her, but since this breakup, Psycho had been basically stalking her. He called Kim constantly, and he came around and literally shouted at her from outside the apartment. And lately, Psycho had been showing up more and more often at her apartment because he had discovered that Kim had gotten back together with one of her ex-boyfriends, and so he was very jealous. And so Kim scanned the street one more time and saw that no one was there, and so she took a deep breath like she was trying to relax herself. Then she walked to her garage, opened up the garage door, and then slid inside of her white Honda Civic car and cranked up the stereo. She loved all kinds of music, but hip-hop was her favorite when she was going out. Kim drove about 15 blocks to pick up her friend, and as she did this, she refused to let thoughts of Psycho come into her head because that would ruin her night, and she didn't want that. And so after getting her friend, the two young women had a great night out. They ate dinner and then eventually ended up at a club where they danced all night until the place shut down at about 4 a.m. on March 1st. Kim drove her friend home, and even though Kim was extremely tired from being out all night, she was in a great mood. And then after dropping her friend off, a few minutes later, Kim pulled into her own garage. By this point, Kim's contacts, her blue contacts, were starting to hurt her eyes. All she wanted to do was just take them out and fall asleep in her bed. She actually had to work later that day, so she really needed to get a few hours of sleep. Kim stepped out of her car, but immediately she froze because she heard something in the darkness. She turned, but she couldn't see anything, and then she heard a noise from the other side of her garage. Terrified, Kim just clutched her keys in her hand and rushed towards the open garage door. Later that day at 4 p.m., Kim's father, Tommy Antonakis, knocked on the door of his daughter's apartment. Kim's friend, April, opened up the door, carrying her son in her arms, and she could tell right away that Tommy was upset. She asked him what was going on, and he said he hadn't heard from his daughter all day. Tommy stepped inside the apartment, and at the same time, April's boyfriend, Josh, came over to say hello, but he also could see how upset Tommy looked, and so Josh just stayed quiet and kind of waited to be told what was going on. Tommy asked April and Josh if they had any idea where Kim was, and they would tell him that they actually hadn't heard from Kim since she left the night before to go out, but they also didn't want to tell her father that this was actually pretty normal for Kim. Josh and April figured that Kim had either gone home with the guy she met, or maybe stayed out super late and crashed at her friend's house. But then Tommy told them that his daughter had not shown up for work that day. Kim actually worked for her father's girlfriend, and the girlfriend had called Tommy that day to let him know she was not in. At this, April and Josh both got very concerned looks on their faces. As much as Kim liked to go out and party and have a good time, she was also very responsible when it came to school and work. She would never just not show up for work without calling. And on top of that, Kim did have a cell phone, which still wasn't very common at this time, but she hadn't answered any of her father's calls. And so Josh asked if maybe Kim had tried calling Tommy at his house. But Tommy said he'd only missed one call on his home phone that day, and when he checked the message on his answering machine, it was just static, so he had no idea if, that was his daughter or not. And so Josh asked Tommy if he wanted to go down to the garage to see if Kim's car was there. Tommy agreed this was a good idea, so the two men made their way out of the apartment and across the street and opened the garage door, but Kim's white Honda Civic was not inside. Now, both men didn't know how to react to this. However, Josh kind of threw out there that, hey, this could be a good thing. This might mean Kim is actually still with her friend. But now Josh also looked as worried as Tommy. A few minutes later, Tommy left the garage and the apartment and went straight to the nearest police station. And when he got there, 2 officers listened to his story, but they told him that even though of course he was concerned, that realistically, an adult woman who hadn't even been gone for 24 hours at this point did not warrant a missing persons report, at least not yet. But Tommy begged them to please at least go to his daughter's apartment to see if maybe they could find anything out of the ordinary. And now at this point, Tommy was so distraught that the officers were actually worried that he might have a total mental breakdown right there in the station. And so they told him, okay, we'll swing by your daughter's apartment and have a quick look around. And so a little later that afternoon, Tommy stood outside of Kim's garage while the officers searched inside the garage. And at some point, one of the officers knelt down and waved his partner over because he had found a gold earring laying on the ground. And when Tommy heard this, he lost it. He said this had to be proof something bad happened to his daughter. The officers tried to calm him down, telling him, hey, her earring could have just fallen out when she got into the car. That's not totally out of the realm of possibility. But they did tell Tommy they would now issue a search for her vehicle and let him know if they found anything. Tommy then gave the officers a photo of Kim and said she had 2 distinct tattoos that people might have noticed, depending on how she was dressed. There was a scorpion on her left thigh and an infinity symbol on her lower back. The cops said they'd keep Tommy informed and then headed out. Tommy immediately went back to Kim's apartment, and when he got inside, he said to April and Josh that he knew something was wrong here, and he didn't think the police were taking him seriously. And so he asked Josh if he would help him put up missing person flyers with Kim's picture all around the city, and Josh said, yeah, whatever you need, I'll help you. And so while the 2 men laid out their plan for these missing person flyers, April contacted the friend that Kim had gone out with the night before. And the friend said that, her and Kim had stayed at the club until around 4 a.m. when it closed, and then afterward, Kim had dropped her off, and that was the last the friend had seen Kim. And so after April relayed this information to Tommy, Tommy became convinced that this, in conjunction with the earring that was found in the garage, meant something must have happened to Kim in the garage right when she got home after dropping off her friend. And so Tommy looked at Josh, totally despondent, and said they were already running out of time if they wanted to find Kim alive. On March 3rd, so 2 days after Kim had gone missing, Kim's mother arrived in town. Over the last 2 days, her ex-husband, Tommy, had continued to put up flyers all around the city, and the police had really ramped up their search for Kim and her car, but nobody had any idea where Kim was. So that's why Kim's mom had come to New York to conduct a search for her daughter in her own way. Kim's mother walked through a small row house in the Bay Bridge neighborhood of Brooklyn, and the house was dark and smelled of incense and candles. She stepped through a curtain at the back of the house and entered a room where a woman with long dark hair sat at a small wooden table. This was the psychic Kim's mother had come to see. The psychic told Kim's mom to take a seat and then asked her how could she help. Kim's mom fought back tears and said her daughter had not been seen in days. She put a photo of Kim and a few of Kim's personal belongings on the table, then she pulled out a small tape recorder from her purse and asked the psychic if she could record this session. The psychic nodded and then touched the objects that belonged to Kim. Then the psychic closed her eyes and took a deep breath. For a minute, the only sound in the room was the hypnotic click of the spinning tape in the tape recorder. Then the psychic opened her eyes and began talking. She said to Kim's mother that Kim was alive, but she was no longer in Brooklyn. She was tied up in someplace cold and dark, maybe a basement. Then the psychic looked up like she was trying to see something in the room that was invisible to everybody else, and she told Kim's mom that different letters had begun to appear in front of her, and one of them was a big letter T. A moment later, the psychic sort of came out of her trance, and at this point, Kim's mom hit stop on the tape recorder. Later that day, Kim's mom met with April, Josh, and Kim's ex-boyfriend, Jay Negron, at Kim's apartment. Kim's mom knew that her daughter had started sleeping with Jay again, even though Kim didn't really like him. Kim's mom didn't think this was a good idea, but she was happy to see that Jay was there and willing to help. Kim's mom took out her tape recorder and said she had come from a meeting with a psychic. Jay stifled a laugh and glanced over at Josh and April, but they looked like they were taking this very seriously. The recording started, and Jay quickly stopped smirking. The psychic's voice on the recording sounded eerie, like it was coming from someplace far away. And when the psychic got to the part about seeing the letters in the room floating around, everybody got a deadly serious look on their face. April didn't want to say anything in front of Kim's mom, but she thought the letter T that the psychic saw clearly pointed to a particular person, Kim's father, Tommy, T for Tommy. At 2 a.m. on March 4th, 3 days after Kim had gone missing, a man woke up at his house in Queens, New York, about 30 minutes from Kim's apartment. The man smelled smoke, so he rushed out of his bedroom, but he quickly realized the smoke was not coming from inside of his house. So the man ran outside and looked down the street, and flames engulfed an old wooden 2-story house down the block, and smoke was pouring out of the windows. The man ran back inside and called 911, and he would tell the operator that the house that was on fire had been abandoned for a long time, but there could be squatters inside, so it was possible there were people in immediate danger right now. So the operator said they would send fire and rescue right away. Soon after that, fire trucks roared down the street with their sirens wailing, and they arrived in front of the abandoned burning house. Firefighters got right to work, and luckily, once they got inside, they could tell the house did seem to be empty, and they were able to put out the flames quickly. But then several firefighters walked through the now smoldering house to try to discover what the source of the fire had been. And one of them led the way down the stairs into the basement of this building, and he quickly told the others to stay back. He had seen some terrible things on this job, but what he saw in the basement was the worst he had ever seen. The others called down to him and asked if he was okay, and he just turned and shouted up that they needed to get the police down here right away. Later that morning, detectives Louis Pia and Tom Shelvin of the NYPD arrived at the burned-out building in Queens. Other cops thought that Pia and Shelvin made the perfect team. Pia could talk to anyone and seemed like their best friend right away, or maybe their favorite uncle. He was known on the force for getting guilty people to quickly confess to their crimes, because they suddenly just wanted to do the right thing and not let Pia down. On the other hand, Shelvin was quiet and methodical. Other cops said when he analyzed evidence at a scene, it was like he could transport himself to the moment of the crime and see exactly what had happened. Pia and Shelvin could still smell smoke as they walked through the burned-out house. They descended the stairs and stepped into the basement. And just like the firefighter, these two experienced New York homicide detectives could not believe what they were looking at. In the basement, slumped over in a burned-out chair, they saw an obvious corpse that was charred from the waist up. This person's clothes and their facial features had been completely and utterly burned off. The detectives walked closer to the body, and they were able to identify that the victim was almost certainly a woman, and she still had pieces of burned duct tape on her wrists that had been used to bind her hands behind her back. Detective Pia stared at the body. He knew it was not much of a consolation, but he said he hoped this poor woman was already dead by the time her body was on fire. Detective Shelvin crouched down to get a better look at the body, and as he did, he leaned in close, and he saw something on her left thigh that caught his attention. He shouted to Pia, and Pia also crouched down next to him. Through the very badly burned skin on this woman's leg, the detective saw a scorpion tattoo. The two detectives walked around the chair, which had actually mostly survived the blaze, intact, and they looked at the woman's back. Most of the skin was completely charred, but a small piece of skin on her lower back was not as badly burned as the rest of her. And that's where the detectives saw the infinity tattoo. Pia called into the station and was quickly put in touch with an officer who had been working a missing persons case in nearby Brooklyn. And the officer said those two tattoos that were found on the victim inside the basement matched the description of a young woman who'd been missing for a few days in the area. Pia knew he would need to get dental records to actually confirm everything, but he knew deep down they had just discovered the body of Kim Antonakis. The following day, detectives Pia and Shelvin met with April and Josh at their own apartment. The couple had moved out of Kim's apartment so her mother could stay there, and so now Josh and April, who were very shaken up, took turns speaking to the police about what happened to their friend, while the other parent would stay with the son. Pia and Shelvin wanted to know about any close relationships Kim had, particularly romantic or sexual relationships. Something about the horror and brutality at the crime scene had made the detectives think that maybe an angry or jealous boyfriend was the most likely culprit. April and Josh, who again were kind of shell-shocked by everything that had happened, basically said the same thing to police, that Kim had begun seeing her ex-boyfriend Jay again, but honestly that did not seem very serious. However, there was one person they felt like the cops needed to speak to right away, and that was Kim's other ex-boyfriend, whose nickname was Psycho. Now, the detectives couldn't believe this guy actually referred to himself as Psycho. It was like advertising yourself as a violent criminal. But then, after talking to April and Josh about how psychotic Psycho really had been after stalking Kim and being totally maniacal after she had broken up with him, well, the detectives were pretty sure they had the perfect suspect who, maybe his nickname was right on brand. And it didn't take them long to discover that Psycho had ties to the Russian mob in New York, and that he was out on bail from a statutory rape charge, and that he had a history of physically assaulting people who made him angry. So later that day, the detectives tracked down Psycho and called him into the station for questioning. Psycho walked into the interview room with a level of confidence the detectives weren't used to seeing in suspects. Psycho was tall, pale, blonde, had blue eyes and a light beard, and when he sat down across from the two detectives, he grinned and actually laughed before either of the detectives had asked him anything. Detective Pia told Psycho that Kim Antonakis had been murdered, and after that, Psycho just stared at Pia, completely calm and unaffected. And so Pia eventually broke the silence by asking Psycho how he knew Kim, and at this, Psycho smiled and laughed again. And then he said, the name Kim rings a bell, but I can't really picture her. Pia smiled right back at Psycho and asked, hey, if you don't know who Kim is, then why do you have her name tattooed on your leg? Psycho leaned back in his chair and got a look on his face like this was the most ridiculous thing he'd ever heard. He said he did have the letters K-I-M tattooed on his leg, but it wasn't for this girl Kim. It stood for something that wouldn't make sense to these detectives. It was just a positive phrase that inspired him. The detectives looked at each other, and they almost started laughing. Psycho's act would be entertaining if he wasn't a murder suspect, so Pia leaned in and told Psycho to stop lying. The police knew Psycho had been coming around Kim's apartment after she broke up with him, and also several people had told the detectives that they had seen Psycho physically on Kim's block the day she disappeared. At this, Psycho lowered his eyes and dropped the tough guy act. He admitted to not only knowing Kim, but also dating her at one point, but he still insisted his tattoo had nothing to do with her and that their relationship wasn't actually all that serious. And then he told the detectives that he really had nothing to do with her death. By the end of the interview, despite Psycho seeming like a totally psychotic and very likely suspect, the detectives did not have enough information to actually hold Psycho, so they let him go. However, based on his criminal record and his connection to the victim, they were able to secure a warrant to conduct surveillance on him. The detectives hoped that surveillance would pay off quickly, but in the meantime, they decided to move on to another one of Kim's ex-boyfriends, Jay. A few days after Kim's murder, the detectives met with Jay at the station, and they had a much easier conversation than they'd had with Psycho. Jay told them that he and Kim had been dating for a while, and even though they split up for a time, they had been back together at the time that Kim disappeared and was ultimately killed. The detectives both took note of this. April and Josh had made it sound like Kim was sort of back with Jay, but it wasn't serious. They were just sleeping together, and so maybe this upset Jay. Maybe he wanted more from her. Maybe he did want to be fully back together, and, when Kim didn't want that, maybe he got angry and kidnapped and killed her in a rage. But the detectives didn't let on what they were thinking. Instead, they just let Jay keep on talking. And eventually, Jay would say that there was actually someone the cops needed to look into. At this, Pia raised his hand to stop Jay and said, yep, they'd already spoken to Psycho, but Jay shook his head. He wasn't talking about Psycho. The cops needed to investigate Kim's own father, Tommy. The detectives looked at each other surprised. Tommy had rushed to the police first, and he had been trying to find his daughter even before the NYPD launched a full-scale search, and Tommy, by all accounts, had been devastated the second he found out his daughter could be in trouble. So Pia asked Jay why on earth would he think Tommy had anything to do with what happened to his daughter. Now, Jay did not want to say the real reason, that a psychic had told Kim's mother about seeing a letter T floating in the air, because he figured the detectives would laugh in his face if that was his reason for suspecting Tommy. And so instead, Jay lowered his voice, like he was afraid somebody could be listening to him, and he told the detectives that he was pretty sure Kim's father, Tommy, had connections to the mafia. This seemed completely out of left field to the detectives, but Jay said he knew the family pretty well, and he really was not making this up. All they needed to do to confirm this was just look into Tommy's businesses. The detectives chatted with Jay for a bit longer, and then eventually they wrapped up the interview and thanked Jay for coming in and sent him home. After he was gone, the detectives struggled with what they had to do next. The idea of interrogating a father who had just lost his daughter in such a violent, horrific way made both detectives feel sick. But unless the cops surveilling Psycho found something basically right now, they had to keep digging if they were going to find out what happened to Kim. And so later that day, Pia and Shelvin drove to Tommy's house, and Tommy came to the door and welcomed them inside, but he looked horrible, like he hadn't slept in days. He was jittery, and he struggled to even put full sentences together. And then Pia told Tommy they were actually there to question him. And at this, Tommy lost it. He screamed that they were just wasting their time while his daughter's killer clearly was out there roaming the streets. And if they knew how to do their jobs, they would not be questioning him about the murder of his beloved daughter, the person who meant more to him than anybody else in the world. Pia told Tommy that it really was just routine for police to follow up with everyone who was close to the victim. And Tommy at this, managed to calm down a bit, but he was still very upset about this. And so Pia just got right to the point and asked if Tommy had any connections to the mafia. Tommy shook his head. He couldn't believe where this investigation was going. He said they could look into his businesses or whatever they wanted, and they wouldn't find any links to organized crime. He said, yes, he did happen to have an office near the office of famous New York mobster John Gotti, and he had met some of Gotti's people in passing a couple of times, but that was it. There was no actual connection to the mafia. And then Tommy just began shouting for the detectives to do some real work and go find his daughter's killer. The detectives could tell Tommy was not willing to talk to them right now, so they quickly left the house and just headed back to the station. As a father, Pia knew how gut-wrenching it must be for Tommy to hear someone even suggest he might have done something to hurt his own child. But as the detectives dug into Tommy's potential ties to the mafia, something did jump out at them. Tommy owned several businesses, and one of them was a fire insurance company. Detective Shelvin said that, regardless of whether Tommy had mafia connections or not, as someone who dealt with fire insurance professionally, he would likely know how to burn a house down and leave nothing traceable behind. And if the guy in Queens hadn't smelled smoke and woken up when he did, there was a chance firefighters would have not stopped the blaze before it basically totally consumed Kim's body. Pia hated to even consider this theory, and he still hoped it was just a matter of time before Psycho or somebody else made a mistake and proved that Tommy had not murdered his own daughter. But as the days went by, police didn't seem to be getting closer to pinning down Psycho or anyone else. The case was just wide open. Police did, however, finally locate Kim's abandoned car miles away from her apartment, but it had been completely wiped down, so there were no prints to point the detectives in the right direction. And so soon, months went by with no new leads, and Pia and Shelvin felt like they were running out of ideas. So they engaged in what they called, quote, shoe leather work, end quote, literally walking the streets around Kim's apartment and the house in Queens where she had been found, knocking on doors and talking to anybody they could. It felt like a very thankless job. But then, in June of 1995, so 3 months after Kim's murder, the detectives got a call from a police officer in the Queens neighborhood they'd been walking around in, and they would tell the detectives that another body had turned up. And this body was a young man who had been murdered in the street, literally, mafia execution style. Pia and Shelvin got the victim's details and then sped to his house in Queens. When they got there, the victim's mother let them in and said they could look around to see if they could find anything that would help their case. She told them that she had no idea who had killed her son. However, she did tell them her son had begun hanging around what she considered to be a bad crowd. Pia sat and spoke to the very upset mother some more while Shelvin searched the house. And at some point, Shelvin got to a room at the back of the house and he looked out the window, and just over the fence, he could see the backyard of the abandoned house where Kim's body had been found. Shelvin walked back through the house and asked the mother if she'd ever seen anybody going in or out of that abandoned home, or if she knew if her son had ever gone in there for any reason. And the woman said, she hadn't seen anybody go in there for well over a month and really couldn't imagine why her son would have gone inside either. The detectives thanked her for her time, and then they headed back to their car. And once they got in there, they both agreed there was just no way this could be a big coincidence, that this young man who had been murdered mafia style just happened to live right behind the abandoned house where Kim had been murdered. And with all this talk about the mafia connection to Kim's murder, it just felt like this young man's murder had to be connected to Kim's in some way. They just didn't know what that way was. On September 3rd, 1995, so 6 months after Kim's murder, detectives Pia and Shelvin sat at their desks and went over their notes like they had been doing almost every day since the murder. They had found a possible connection between Kim and that young man who was the shooting victim in Queens, but nothing concrete had come out of that yet. On top of that, Psycho, despite being under surveillance, had not shown his hand in any way, and also the detectives had discovered that Kim's father, Tommy, really had absolutely no discernible ties to the mafia. So at this point, none of their leads had panned out. However, the detectives refused to say that Kim's case had gone cold. but they admitted it was, at the very least, lukewarm. But just then, the detectives heard shouting and crying down the hall. They looked up and saw an officer leading a blonde woman towards them. The officer had an apologetic look on his face, and he said, this woman claimed to have vital information regarding Kim's murder, and she kind of barged her way down here. Now, a lot of people had made similar claims over the past several months, so Pia and Shelvin understood why this officer was hesitant to let this woman come down and talk to them right away, but they stood up, and they could see how upset this woman was. Also, it looked like she had some serious bruising on her cheeks and around her eyes. So the detectives walked over to the woman and wanted to make sure she didn't need immediate medical attention. But the woman shook them off and said she needed cops, not doctors. Pia nodded and said, "Okay, well, what's your name?" And she smiled through tears and pointed to her hair and said everyone just called her Blondie. Pia smiled back at her and asked her to tell him and his partner, what's going on here. Blondie took a deep breath and stopped crying. She said that morning, she and her boyfriend had gotten into an argument. Blondie said she was sure he was cheating on her. And so she got very upset and angry and began yelling at him, but instead of just yelling back at her, her boyfriend grabbed a shovel and hit her with it. Blondie fell to the floor and thought her boyfriend was going to literally kill her, but he ended up just running outside, stealing her motorcycle, and speeding off. Pia told Blondie, I'm so sorry, and then told her she really ought to go get some medical attention, but then he also asked her, what does this have to do with Kim's murder? Blondie glanced between Pia and Shelvin and took a deep breath, and then she said, while she was on the floor after being struck by the shovel and thinking she was about to be killed, her boyfriend, before running off, leaned down, got into her face, and told her he had already set one woman on fire and he would have no problem doing it again. The detectives asked Blondie who her boyfriend was, and when she gave them the name, they knew he had been telling Blondie the truth about previously burning someone because they knew her boyfriend had to be Kim's murderer. Based on the information Blondie provided, interviews, and evidence found at the crime scene, the following is a reconstruction of what the detectives believe happened to Kim Antonakis beginning in the early morning of March 1st, 1995. On March 1st, at about 4 a.m., the kidnappers sat crouched behind a parked car a few feet away from Kim's garage. It was getting colder outside, and the kidnappers were tired of waiting. Finally, they saw a white Honda Civic coming down the street, and they knew it had to be Kim's. And so the kidnappers stood up, and after confirming it was hers, they ducked back down. They were wearing all black clothes, gloves, and face masks, so they remained hidden in the darkness. From their crouched position, they watched as Kim's car pulled into the garage, and they waited right outside. Once the overhead light inside of the garage went out, each of the kidnappers crept inside and crouched down on opposite sides of Kim's car. The hip-hop music from inside the car cut out, and then Kim turned off the engine. At this point, the kidnappers were totally still, fixated on the driver's side door. The door opened and Kim stepped out, but immediately she stopped, because when she looked to one side of the garage and then the other, she saw something moving around, she heard something, it scared her, and so she began rushing towards the open garage door. At this point, one of the kidnappers leapt out of the darkness and surprised Kim from behind. They wrapped their arms around her, but Kim screamed and thrashed with her elbows and almost broke free. She scraped her long fingernails down the kidnapper's arm and thrust her keys at the kidnapper's face. And finally, the kidnapper's grip loosened and Kim got away. Kim made a break for it, but at this point, the other kidnapper leapt at her and brought her to the ground. It was at this point one of her earrings fell out and landed on the ground. Kim kept on fighting, but the kidnapper now had her pinned. And then suddenly, Kim's head slammed against the ground, completely stunning her. The kidnapper on top of Kim turned her over onto her stomach and pulled her arms behind her back. At this point, the other one rushed over and unrolled a strip of duct tape and bound Kim's hands behind her back. Then both kidnappers flipped her back over. Kim would have felt a piece of duct tape being stretched across her mouth, and then would have felt her head slam against the ground one more time, at which point she lost consciousness. The kidnappers lifted Kim up and threw her in the trunk of her own car, and then sped down the street in her car and drove from Brooklyn to Queens. They made their way to that abandoned house and parked right out front. The street was pitch black and nobody was out that early in the morning. So the kidnappers just pulled Kim out of the trunk and dragged her right into the abandoned house and down the steps into the basement. Once in the basement, Kim began regaining consciousness and she screamed through the tape, but the kidnappers threw her onto a chair, crouched down, taped her feet, and then walked out of the basement, locking the door behind them. Kim would remain in that basement for about 36 hours without food or water, just sitting in that chair all tied up until the cold sent her into the final stages of hypothermia. She drifted in and out of consciousness and started hallucinating, so she could never really tell if she was alone or if people were there with her. Then, in the early morning of March 4th, 3 days after Kim was kidnapped, the basement door flew open again. Kim's kidnappers remained at the top of the stairs, but Kim's killers walked down the steps into the basement, and one of them held a gas can. The killer with the gas can walked right up to Kim, and from the looks of it, Kim seemed dead. But the killer didn't care. The killer leaned down, kissed Kim on the forehead, and said, quote, "Shit happens and life sucks," end quote. But the truth was, Kim was not dead. Hypothermia had simply slowed down multiple functions of her body, so she appeared dead, but certainly was not. Which means Kim was fully alive when the killer doused her with gasoline, took several steps back, lit a match, and flung it at her, setting her on fire. Once the fire started, the killers and the kidnappers turned and fled the scene and watched from outside as the house went up in flames. Then the killer and the kidnappers got in 2 separate cars and drove away. Eventually, the killers made it back to Brooklyn and they split up. One just kind of walked the streets for a while the other went back to their apartment and checked in on their 2-year-old son before they went to bed. It would turn out the man who called himself Psycho, that police really believed must have had something to do with Kim's murder, had nothing to do with it. And as for Kim's father, Tommy, he loved his daughter more than he loved anyone, and he would never have done anything to hurt her, just like he said. The truth was, Kim's horrific murder had taken place simply because somebody wanted a new car. Josh Torres, the man who'd been staying at Kim's apartment with his girlfriend April and their 2-year-old son, really liked Kim's white Honda Civic. And he started thinking that he really wanted a car just like that, or one maybe even nicer. And Josh's good friend, Jay, just happened to be Kim's ex-boyfriend, and he knew firsthand that Kim's dad was rich and could easily hand over enough money for Josh to get whatever car he wanted. And Jay was willing to help Josh pull this off because deep down, Jay knew that Kim did not really love him the way he loved her, and so he knew this relationship was never really going to amount to much. And also, Jay figured he wasn't really ripping Kim off, he was just ripping off her rich dad, who could easily afford giving up some money. And so Josh came up with a plan to kidnap Kim and get ransom money from her dad. And he reached out to 2 friends to pull off the kidnapping job, and one of them lived near an abandoned house that he said would be the perfect place to stash Kim until her dad forked over the ransom money. Jay, who knew Kim's schedule really well, helped the other guys, the kidnappers, work out the details of the plan and pick the perfect time to put it in motion. And in the early morning of March 4th, when Kim was kidnapped, everything seemed to be going the way it was supposed to. But later that day, things began to fall apart. After the kidnapping, Josh called Kim's father, Tommy, and played him a pre-recorded ransom demand, telling Tommy to leave $75,000 at a specific location at a specific time. But Tommy's answering machine did not pick up the recorded message. Instead, it just sounded like static, and Tommy had no idea that message had anything to do with his daughter. And when Tommy showed up at the apartment asking Josh for help, Josh panicked. So he did everything he could to make it look like he was desperately trying to find Kim, while he and Jay secretly figured out a different way to get Tommy the ransom message. But then everything changed again when Kim's mother came to town and visited the psychic and played that recording for Josh and Jay. Because the psychic correctly said Kim was no longer in Brooklyn and that she was in a cold, dark basement. But more importantly, the psychic did not just mention the letter T floating around, she also said that she kept seeing one other letter, the letter J. And when Josh and Jay heard that, they freaked out because their names begin with J. And so, totally convinced the psychic knew exactly what was happening, Josh and Jay went to that abandoned house where Kim was with the 2 guys they had hired to kidnap Kim. Josh had picked up a gas can on the way over, claiming they would just move Kim to a different location and then burn the abandoned house down, kind of destroying evidence. But investigators would never know if that was actually Josh's intention. Because when Josh saw Kim in the basement and thought she was dead, even though she wasn't, she was just hypothermic, Josh would say he felt like the only way to deal with the situation was to light her on fire and burn her body along with the house, destroying all evidence. But of course, Kim was actually alive. Detectives Pia and Shelvin had actually begun to suspect Josh and Jay when that dead young man turned up in Queens, the guy who was shot out in the street, mafia execution style. That young man, who would turn out to be one of Kim's kidnappers, had connections to both Josh and Jay. But it was ultimately Blondie, the woman who had been attacked by her boyfriend, who broke the case wide open. Because Blondie's boyfriend at the time was Josh. Not long after Kim's murder, he had left April and their kid and started seeing Blondie. Police arrested both Josh and Jay, and Detective Pia very quickly got Jay to tell him absolutely everything that had happened. In fact, Jay cut a deal with the prosecution and would only serve 2 years in prison. As for Josh, he was not found guilty of the execution-style murder in Queens of that young man. However, he was found guilty of kidnapping and murdering Kim and was sentenced to 58 years to life in prison. Kendall Mott kept his eyes locked on the road as he drove towards the home of his father, 58-year-old George Mott. It was 6 p.m. on March 26, 1986, and the sun was hanging low in the sky over Crown Point, which is a small country town in upstate New York. A few hours earlier, 32-year-old Kendall had received a phone call from his sister Kimberly. She had called their dad multiple times over the course of that day, but all she kept getting was his answering machine, so Kimberly was worried. Part of that worry came from the fact that their dad lived alone since he had divorced their mom a few years back. On top of that, his health was declining. George was an ex-smoker, and now he had some serious issues with his lungs. He used an oxygen mask, and he'd just recovered from a bout of pneumonia that had sent him to the hospital for a few days. Kimberly was afraid their dad might have fallen or passed out, or maybe even something worse. She knew it would be somewhat convenient for Kendall to stop by their dad's place on his way home from work, so she called him and begged him to go by and make sure their dad was okay. And of course, Kendall had said yes. But as Kendall drove through the woods down a lonely 2-lane road, he really wasn't too worried. He had visited with their dad at his house 2 days earlier. George was taking his medications and was in good spirits considering all the issues he'd been dealing with. Kendall was sure there was a reasonable explanation for why George wasn't answering his phone. Maybe George's friends picked him up and took him to a local diner called the Wagon Wheel, where Kendall knew they liked to hang out. If that was the case, then Kendall knew he wouldn't be gone for very long, and so Kendall planned to just wait inside the house until his dad came home, and then once he was back and he knew he was okay, Kendall would call Kimberly and everything would be fine. And regardless of if there was a problem or not with his dad, Kendall was happy to pop by because he was close with his dad. His dad used to be a firefighter, and he was very devoted to his profession. He spent long hours at the station away from the family, but since his retirement a few years ago, he was much more present in the lives of Kendall, Kimberly, and their children. And that really made Kendall happy. A few minutes later, Kendall pulled off the main road and began making his way down a long driveway that wound between tall maple trees. George lived in a tiny one-bedroom house in a sparsely populated area about 4 miles west of town. It was very peaceful and quiet and green out there. The nearest neighbor lived about a half-mile away. At the end of the driveway, Kendall parked his car a few feet away from his dad's house. He hopped out and then walked up to the front door. But as he got closer, he noticed that the windows near the front door looked a little bit different. They had a dark tint to them, kind of like the windows on a limousine. Kendall thought that was very strange, and he figured he would investigate once he got inside. And so Kendall got up to the front door and he knocked, but his dad didn't come to the door. And so Kendall reached down and tried the doorknob, and right away he felt two things. One, he felt the doorknob was already unlocked, and two, most importantly, he noticed the doorknob was hot to the touch. And immediately, a bolt of fear shot through Kendall, because a hot doorknob could mean there was a fire raging inside the house. And so Kendall immediately whipped open the door and looked inside, but there was no fire. In fact, the house was totally quiet and nearly pitch black. Kendall instinctively reached over and flipped the light switch, but the lights didn't turn on in the house. Even worse, there was this thick, dark haze hanging in the air that was impossible to see through. It smelled a little like smoke, but it also had this strange, sweet odor to it that made it much more unsettling. Everything Kendall was experiencing just felt totally dangerous. Whatever was going on here, Kendall knew it had to be bad, especially given the fact that his dad had lung issues. Breathing in whatever was in the air could not be good for him. So Kendall stepped into the front living room and yelled out for his dad, but there was no reply. Kendall felt his way through the furniture in the living room towards the back of the house to the bedroom where his dad slept, But when he got there, again, he just couldn't see anything. Kendall was really starting to panic now. He was desperate to get his hands on a flashlight, but he didn't have one, and he didn't have one in his car, and so Kendall turned, sprinted outside, got into his car, and sped over to the house next door to see if the neighbor had a flashlight. Luckily, the neighbor was home, and they did have a flashlight, and so after explaining what was going on, the two of them raced back over to George's house with this flashlight. But when Kendall arrived back at his dad's front door, he stopped. He was holding out hope that his dad was not home, and that he was safe, and that whatever was going on inside of his house had nothing to do with his dad. But Kendall also realized that now that they had this flashlight, when the neighbor went in there and shined it around, he might reveal something totally horrible to Kendall. And suddenly Kendall, standing there right in front of the door, he just felt like he couldn't handle that. He couldn't go in and see whatever happened to his dad. So Kendall stayed outside as the neighbor clicked on his flashlight, pulled the collar of his t-shirt up over his nose and mouth, and stepped into the house. The next few minutes were agonizing for Kendall as he waited to hear what was hidden beneath the black haze inside his father's home. Finally, the neighbor emerged from the house, and from the grim expression on the man's face, Kendall could tell something horrible had happened. Within the next hour, the house was filled with inspectors from the local police and fire departments, and all of them were deeply confused by the scene laid out before them. It didn't take them long to determine that a fire had broken out inside of George's house, but the way the fire behaved just didn't make sense. As the inspectors stepped through the front door and into the living room, they could see that there was a layer of black soot covering everything. But nothing in the room was actually burnt. It was clear that it had gotten very hot inside of that house. Sitting on a table in the middle of the room were 3 pill bottles that had all melted together into one plastic clump. There was also a nail hammered into the wall, and hanging from it was the metal handle of a fly swatter. But the flat plastic square that actually swats the flies, that part had melted off. Inspectors found other plastic objects in the living room that were warped or liquefied, but there was plenty of other stuff inside the house that should have melted, but for some reason didn't. There was a plastic model of an old sailing vessel that sat on the coffee table not far from the fly swatter and pill bottles, but it looked as good as new. There was also a stack of cassette tapes that sat next to the stereo that looked unaltered and ready to be played. The right side of the living room opened out into a small kitchen. George had decorated the sides of the refrigerator with colorful wallpaper, and that paper showed 0 signs of burning. But inside the refrigerator was a totally different story. The butter was completely melted, along with the plastic butter dish. In the meat drawer was an unopened package of hot dogs, and they were all cooked. The inspectors struggled to comprehend what actually happened. How could a refrigerator turn into an oven on the inside while the outside of it was totally unaffected by the heat? And things got even weirder as the inspectors moved to the back of the house to George's bedroom. As they stepped inside, inspectors could see the TV on George's wooden dresser was caved in on the top, where the plastic shell had melted down into itself. But the dresser it was sitting on was good as new, aside from the layer of soot that covered it. In the corner of the bedroom was George's oxygen machine. Not only was it undamaged by the heat, it was still running when the inspectors arrived. Resting on top of that machine was George's plastic oxygen mask. Unlike the television, the mask had not melted. This was made all the more strange because the mask and the machine were just inches from the bed, where clearly an intense fire had raged within the last day. Now the fire was out, leaving behind a scorched, tangled mess. The wooden bed frame was charred in places, but it was still standing up. The mattress, however, was totally destroyed. The stuffing was all burnt up, and the net of metal mattress springs were melted in a way that made them curve down into a V shape under the bed. You could actually see through those springs and underneath the bed, where a large hole had burned through the floorboards. But as the inspectors crouched down to take a closer look into that hole, they could see that something else had burned up in this strange fire. Tangled in the mattress springs was a man's foot, burned off near the ankle. Near the headboard was a charred fragment of a human skull. Beyond that, they found tiny piles of fine black ash in the wreckage of the bed, as well as in the crawl space beneath the floorboards. Those ashes, along with the foot and the skull fragment, were all that remained of Kendall's father, George Mott. Before he died, George was a pretty big, sturdy guy, weighing in over 180 pounds. What was left of him now weighed about 3 pounds, easily fitting inside a shoebox. The confusion amongst the inspectors only continued to grow after finding George. George wasn't just burned, he essentially had been cremated. Cremation is the process where a dead body is burned to ashes, and it requires an immensely hot fire that burns inside of a special oven. Yet somehow, here George was, reduced to ash by this bizarre fire that only affected small portions of the house. It just didn't add up. If the temperature in the bedroom was hot enough to cremate George, how on earth was the house even still standing? But there was yet another mystery hanging over the scene. How did a fire as powerful as this one get ignited in the first place? The inspectors checked the electrical outlets, they checked the gas lines that ran in the crawl space under George's bedroom, they completely dismantled the gas furnace that straddled the bedroom and the living room, and they could not find a single shred of physical evidence that might explain how George caught on fire. A few days later, the New York State police inspectors finally just gave up. They couldn't see any signs that foul play had occurred, so they filed a final report that simply stated that George's death was, quote, accidental. Then they closed the book on the case. But there was one inspector with the Essex County Fire Department who wasn't ready to give up so fast. That man's name was Tony Moret. Tony was 37 years old and had worked in the fire department since he was 16. He had known George Mott personally, they'd worked side by side as firemen, and Tony really liked George. So he was determined to find out what really happened to his friend. On top of all the weird anomalies they found at the scene of the fire, Tony was puzzled by one more thing. He knew George was obsessed with fire safety. Tony just couldn't believe that George would be careless enough to accidentally set himself on fire. But after hundreds of hours exploring every possibility for what could have happened to George, he was getting really frustrated. Tony knew a lot about the science of fire, but none of those scientific rules seemed to apply to what he was observing inside of George's house. Finally, one of Tony's colleagues gave him a tip about an organization down in Harrisburg, Pennsylvania that might be able to help. They were called Parascience International, and they specialized in the study of strange phenomena that couldn't be explained by traditional science. Tony was hesitant at first. When he thought of the paranormal, he thought of things like Bigfoot and UFOs and the Loch Ness Monster. To him, any organization that believed in those sorts of things was an organization he couldn't really take seriously. But he was desperate to find out what happened to George, and his own investigation had reached a dead end, and so he didn't really have anything to lose by considering a different perspective, even if it was totally unorthodox. So, in April of 1986, a few weeks after George's ashes were discovered, Tony took a deep breath, then picked up the phone and made the call to Parascience International. When the phone rang 400 miles away in Harrisburg, it was answered by a man named Larry Arnold. Larry was a 37-year-old school bus driver during the day, but in his off time, he devoted many hours to this group of parascience experts. For the last 10 years, Larry had worked with them to investigate many strange and unusual events. But Larry's greatest passion was studying fire phenomena that defied explanation. So, when Tony told Larry what he needed help with, Larry was immediately interested. Larry listened intently as Tony flooded him with details about the strange case of George Mott. The body reduced to fine ash, the lack of damage to things near the body, the inexplicable pattern of melting and burning throughout the house. The more Larry heard, the more intrigued he became. And so, by the end of this call, Larry said he'd be happy to drive up to Crown Point, examine George's house, and see if he could make any sense of it. And a few weeks later, that's just what Larry did. When he arrived in Crown Point, he met with Tony at George's home. It had been over a month since the fire, but George's family was still in shock and were totally undecided about what to do with the house, so the inside really wasn't all that different from the way the inspectors first found it. As soon as he stepped through the door and into the living room, Larry noticed that the shelves and the tabletops all had a strange glaze on them. It wasn't just soot or ash that you could brush away with your hand. It was almost like baked on, like melted caramel. Right away, a picture began to form in Larry's mind of what could have happened the day George caught on fire. And so Larry headed straight to the back of the house and into George's bedroom. George's remains had been removed, but Larry could still see the area that had burned and how it hadn't spread beyond the bed and the hole in the floorboards. Larry, like every other inspector who had been inside of George's home, couldn't find anything nearby that could have possibly ignited the blaze, but to Larry Arnold, that actually wasn't the least bit surprising. Tony and the other investigators had never seen anything as confounding as this case, but Larry had. It was extremely rare, but in his research for Parascience International, Larry had uncovered about 200 recorded cases that were similar to George Mott's. For example, in the year 1725, a Parisian innkeeper found his wife had burned down to a pile of ashes in the middle of their kitchen floor. Nothing around her was damaged from this fire, not even the wooden cooking utensils that laid close to her charred remains. In 1951, a landlady visited one of the tenants of her apartment building in St. Petersburg, Florida. When she grabbed the doorknob, she found it hot to the touch, and when she opened the door, she found the tenant's body had been incinerated into ashes, except for her skull and one of her feet. Inches away from the body was a pile of newspapers that showed no signs of burning. Another example, in 1970, an 89-year-old widow was found burnt down into a pile of ashes in her home in Dublin, Ireland. The only recognizable remains were her 2 feet, which were burnt off near the ankles. She had a vase with plastic flowers sitting on a table in the center of the room. The flowers had melted into a puddle, but everything else in the room appeared to be more or less untouched. In nearly all of these similar cases, Larry noted the same common threads. There was often a strange, sweet smell reported, and a weird, ashy glaze that seemed to coat everything. There was very little damage to the space surrounding the burned remains, and there was no clear indication of what could have possibly ignited the blaze in the first place. For hundreds of years, scientists and scholars had been developing theories behind how these strange fire events could happen, and the only feasible explanation they could come up with was that these intense fires were actually ignited from inside the bodies of the victims. Back in the 1800s, many believed this was God's judgment delivered to those who led an immoral life. Some thought it could be a byproduct of alcoholism, with the excess alcohol increasing the body's flammability. As the decades passed, many other theories have also been put forward to explain how a human body that is 60% water could spontaneously ignite. Larry Arnold had his own theories. He knew the human body was full of electrical activity that pulsed through the brain, the nervous system, and through every heartbeat, so what if the electricity somehow got amplified? Could the body start an explosive electrical fire that burnt itself out from the inside? Could it burn fast enough and hot enough that it incinerated the victim without burning anything nearby? Whatever the cause, this strange and rare event eventually became so widely known that it got its own name: spontaneous human combustion. When Tony heard Larry's theory, he thought it sounded crazy, but he also thought it made more sense than any other explanation he'd heard for what happened to George. By the time Tony officially finished his own investigation into the death of George Mott, he concluded that the cause was spontaneous human combustion. But despite Tony's support of this theory, the official reports by police never changed for George Mott. His death is still listed as accidental, with no mention of spontaneous human combustion. While there are many believers in the theory, the vast majority of scientists dismiss spontaneous human combustion as pseudoscience that is unsupported by physical evidence. And the physical evidence in this case is still contradictory and confusing. But despite not fully understanding what happened, for instance, why the outside of George's refrigerator was untouched while the hot dogs inside were cooked through, Larry felt confident in his conclusion that George Mott was indeed a victim of spontaneous human combustion. According to the wishes of George's family, his ashes were sent to a crematorium, along with his foot and what was left of his skull. Then, after that second burning, George Mott was scattered at sea and finally laid to rest. Thank you for listening to Mr. Ballen's Medical Mysteries. If you enjoyed today's story, be sure to come back next week because we put out a brand new mind-boggling medical mystery each week. On the afternoon of July 29, 2016, a 23-year-old college student named Felix stood in the break room of the industrial manufacturing company where he worked in northwestern Germany. He poured some cereal into a bowl, and then he took his carton of milk out of the communal fridge, and then with the cereal and his milk, he sat down at a table with two of his coworkers. So Felix was studying to become an engineer, and that was his primary focus. And on his breaks from school, he would work here as a machine mechanic. But as a result of that, basically just being a college kid looking for a side gig, it made him one of the youngest people at this company. And so oftentimes, Felix had a hard time relating to his coworkers, who were all basically a lot older than him. And in fact, now, as he sat down to eat his cereal, the two coworkers that were sitting there already, these two men named Otto and Klaus, who were in their 50s, it's like they didn't even look up and acknowledge him. They just continued silently eating their sandwiches as if Felix wasn't even there. At first, Felix put up with the fact that this lunch break so far was pretty awkward. Like there was no conversation happening here. He definitely felt like he did not belong here. But eventually, the silence was deafening at this table, and Felix just couldn't stand it. And so he said to his coworkers, Klaus and Otto, hey guys, how's the day going? And Klaus looked up and stared at Felix, and he just shrugged, said nothing, and went back to eating his food. Now, Klaus, admittedly, was known as sort of a loner employee who kind of kept to himself, so this behavior was somewhat normal, although somewhat off-putting to Felix, who's trying to obviously start a conversation here. But then Otto, he looked up, and he looked at Felix, and he was about to say something, but then paused, and this grimace came over his face, and he just said to Felix, you know what? I'm not having a good day. My head hurts, my stomach hurts, I feel tired, I feel kind of awful. And so now Felix is like, okay, sorry, Otto, I don't know what to tell you, that's tough. And then the three men just kind of went back to eating and back to silence. Now, Felix didn't know how to make this any less awkward, and so he just went back to eating his cereal in silence, and then when he was done, he got up and left the awkward break room. But Felix had only been back to his job for a couple of minutes when suddenly he felt this intense stomach cramp that made him double over in pain. Now, Felix actually was somewhat accustomed to getting cramps like this one because he was lactose intolerant. And typically, if he consumed dairy shortly thereafter, he would get these stabbing pains in his stomach. That's actually why he kept a carton of his own milk in the communal fridge that was lactose-free. And so suddenly, Felix wondered if maybe he had accidentally grabbed the wrong milk when he had poured his cereal just now. Had he grabbed regular milk, causing this pain? And so as a wave of nausea came over him, Felix sprinted back into the break room, opened up the communal fridge to see if he had grabbed the wrong milk. But he saw there was actually only one container of milk in the fridge, and it was his, the lactose-free kind. And so he had no idea what was actually causing these cramps because it couldn't have been dairy. But at this point, Felix was just so nauseous that all he could think about now was the fact that he could no longer work today. He had to go home. And so Felix told his supervisor he had to go, and then he rushed out to his car, he sped home, and barely made it into his bathroom in time in order to vomit into the toilet. And after he vomited, he felt a little bit better, and so he wiped his mouth, and he stood up straight, took a deep breath, and then he went to the sink and he splashed some water on his face, and he grabbed the towel and he went to dry his face, and as he did, he noticed something. He noticed the tips of his fingers were now tingling, like his hands were going numb. And so reflexively, he put down the hand towel and began flexing and opening and closing his hands over and over again to increase the circulation to his fingers, to maybe get the feeling back, but nothing he did seemed to help. And at this point, Felix couldn't help but feel a little bit scared. Now, stomach cramps and nausea were somewhat normal symptoms for him, considering, again, he was lactose intolerant. Those were normal symptoms of illness. But losing circulation in your hands was not something he was used to. This was something else. And so even though Felix was an adult, he was 23 years old, his first thought was, I gotta call my mom. And so that's what he did. 2 weeks later, Felix was still sick. On his mother's advice, he had gone to see his doctor, and his doctor had told him that he was very likely just overworked, and he prescribed Felix some vitamins and rest. But those two things had not helped Felix. In fact, really, his symptoms had only gotten worse. He was still nauseous, and that tingling feeling he had felt in his hands had now extended all the way up into his forearms. And so as a result of this mystery illness afflicting Felix, he had not been able to go back to work, and he had spent the better part of the last 2 weeks just lying miserably in bed. But this morning, he was determined to get out of bed, take a shower, have a real meal, and basically just have a normal day. And so it started relatively well. He managed to, prop himself up and get out of bed. But as he staggered his way towards the bathroom, he lost his balance and had to grab onto the door to keep from falling to the ground. After steadying himself, Felix did attempt to keep walking towards the bathroom, but it was like the commands from his brain were not reaching his legs. And so he kept slipping and staggering and almost falling. And so eventually he just turned around to go back to bed, but immediately he kind of collapsed to the ground and had to literally crawl painstakingly back to the bed. And then when he had finally pulled himself back on there, he pulled out his phone and called his mom again. But this time, he was not calling for advice. He was calling for help. He needed her to drive him to the hospital. Later that afternoon, Felix laid in a hospital bed with his mother to his left and an emergency room neurologist to his right. The neurologist had heard about Felix's symptoms, and she was now performing a preliminary examination, which really consisted of lots of questions about Felix's drug use, about, a history of neurological problems in their family, had he had any recent head injuries. But basically all the questions she was asking him, he said no to. There weren't any precursors to him having these issues. Next, the neurologist poked Felix's arms to see what he could feel, because he was complaining of numbness and tingling. But it was kind of like wherever she poked in his arms, he couldn't really feel it. It was like the tingling sensation had totally taken over both arms. That's all he could feel. After that, she measured his muscle reflexes in his legs and also shined a light in both his eyes. And then after that, she put her tools down and she looked at Felix with a very worried expression on her face. She said that based on Felix's symptoms, she thought that some part of his nervous system, like his brain or his spinal cord, might be inflamed. And this type of inflammation can lead to things like nausea, numbness, and loss of coordination, all things Felix had been experiencing. And this inflammation could be caused by a number of different infections or an autoimmune reaction. But to know for sure, she would have to run some more tests. And so she advised Felix to be admitted to the hospital. 6 days later, the neurologist went to check in on Felix, who was still at the hospital. And as soon as she walked into his room and saw Felix, she saw he looked terrible. His body was limp, his face was swollen, and his eyes were sort of glazed over, like he was staring off into the distance. By this point, doctors had run imaging scans on Felix and had discovered that his brain and brainstem were inflamed, like the neurologist had suspected. But the neurologist could not figure out why this was happening. Typically, inflammation like this was caused by an infection. But the neurologist had tested Felix for every infection she could think of that could have caused this, and all those tests had come back negative. So her new working theory was Felix must be having an extreme autoimmune reaction, which is basically when your immune system malfunctions and starts attacking your own body. Autoimmune reactions can cause things like brain swelling. But this theory didn't really help Felix very much, because first of all, it was nearly impossible to test to see if this theory was even true, that it was an autoimmune reaction. And second of all, even if you knew that's what it was, unfortunately, autoimmune reactions are notoriously difficult to treat. Basically, it was a shaky diagnosis that did not come with an easy cure. The neurologist had given Felix some anti-inflammatory medication, hoping that maybe that would help, based on her research around autoimmune diseases, but it basically did nothing. And she knew that if she didn't find a way to lower the swelling in his brain and brainstem, that Felix could potentially suffer permanent brain damage or even death. So now, in Felix's hospital room, The neurologist walked over to him and tapped his shoulder, and she asked him how he was feeling. And Felix, when he sort of looked up at her, his eyes were rolled back in his skull, and it took a minute for him to focus on her. And then it was clear to the neurologist that it took all of his energy to croak out an answer. But the words he said didn't make any sense. He said, metal, mouth. And the neurologist said, what? Like, what are you trying to say? And then he said, taste, water. And at that point, the neurologist realized what Felix was trying to say is that he had a metallic taste in his mouth and he wanted a cup of water to clear his mouth. The neurologist felt like this had to be a clue about what was going on with Felix. It was not some random symptom, like this has to be connected to the totality of what was wrong with him. But she didn't know what a metallic taste in his mouth had to do with his other symptoms. And so she was baffled. So she just grabbed a cup of water off the nearby table and handed it to Felix. And Felix immediately put it to his lips and tried to drink it. But it was like he couldn't, and the water just dribbled down his chin onto his chest. And as the neurologist stared at her patient, she couldn't help but feel like she was just totally failing here. I mean, obviously there was something horribly wrong with Felix, but she had not come up with a proper diagnosis yet. And all the medications and treatments she had suggested so far had done nothing for his symptoms. And she knew if she couldn't get the swelling to go down, it was just a matter of time before he suffered permanent brain damage or death. And so at this point, the neurologist realized a big change would have to be made in Felix's care. Clearly what she was doing was not working. And so she decided to transfer him from her hospital to a local university hospital where she knew there were some specialists there who they might be able to figure out what was going on here. But the next day at that university hospital, that team of specialists that had been assigned to Felix's case were just as baffled as the neurologist had been. Because now Felix didn't just have swelling in his brain and a metallic taste in his mouth. He also was experiencing kidney and liver failure. And this collection of symptoms meant Felix very likely did not have an autoimmune condition. They tested him again for more infections that, maybe could still leave the possibility open that it was an autoimmune condition. But again, those still all came back negative. And so effectively, these specialists who were here to, solve this puzzle were back at square one. They had made no further progress. And so at this point, all Felix's doctors could do was just hope that whatever illness was plaguing Felix would sort of resolve itself on its own. And they would just, do their best to manage his symptoms and try to keep him comfortable until it did. However, by September of 2016, so 2 months after that first day that Felix went home sick from work, he had not improved. He spent most of his time laying in bed unconscious, barely clinging to life. At this point, most of these specialists were just monitoring Felix. However, one of them still felt like a diagnosis here was still possible. We just need to keep looking. And so this doctor actually decided that instead of monitoring Felix, he was going to start looking into some medical research papers because he figured, whatever Felix had to be really, really rare. If it wasn't, they would have figured it out by now, and they clearly had not. So he must have something rare. And if there's one place you can go to learn about very rare conditions and diseases, it's medical research papers. And so he began combing through all these papers, and sure enough, he would actually find a case about another patient who had the exact same symptoms as Felix, and they even appeared in the exact same order. First, the stomach cramps and nausea, followed by the tingling in the arms, then the loss of coordination in the legs, then the swelling of the brain, followed by the metallic taste in the mouth, and then ultimately kidney and liver failure. And just like Felix, this patient's diagnosis in this medical journal was not an infection, nor was it an autoimmune disease. Instead, it was a condition that was so rare, it had only been recorded 3 times anywhere in the world over the last century. But this doctor understood that even though Felix's symptoms did appear to match, it still was highly unlikely he actually had this diagnosis because it's so unbelievably rare. However, the doctor thought, well, I'll just rule this condition out. All I need to do is a simple blood test. And so he did this blood test on Felix, literally believing it would just rule this out, except when the results came back, it was positive. This doctor had just solved the case, the one that nobody else seemed able to do. But the doctor was not happy. Instead, as he stared at the test results, he was kind of horrified because this diagnosis was a death sentence for Felix. There was no cure for this. And worse, this diagnosis meant other people potentially could be in danger here. And so the doctor knew his next step, of course, would be to contact Felix's family and tell them what he had discovered. But he also knew this was no longer just a medical problem. The doctor called local law enforcement, and they began their investigation immediately. They interviewed basically everyone Felix ever interacted with on a regular basis, and they also sent forensic technicians to all the places that Felix spent any time. And these technicians ran tests on all the surfaces that Felix might have touched at one point or another. They also ran tests on the food and the water that he might have consumed. They even at one point tried to test the air that Felix had potentially breathed. And they did all this because they were trying to find one very specific substance. But despite basically looking everywhere in Felix's life for weeks and weeks, they didn't find it. Meanwhile, Felix's condition only got worse. By the end of September, he had slipped into a vegetative state. But at least so far, the doctor's worst fears had not been realized. They actually expected other people to begin to turn up to hospitals with similar symptoms as Felix. But they hadn't. So, with no answers, but with no other victims either, the police investigation began to wind down. Felix remained in a vegetative state for months and then years, and officials still just had no idea how this actually happened to him. They just kind of concluded that, well, this was a horrible tragedy that very likely will never actually be explained. But at least hopefully it will never happen to anyone else. But then, 2 years after Felix fell into his coma, some very strange things began to happen at his old manufacturing job. So at this manufacturing company where Felix used to work, it actually was pretty commonplace for employees there to get sick fairly regularly, like more than normal. However, their illnesses were sort of basic. Things like headaches and stomach aches and feeling sort of tired. Things that didn't really raise big red flags. But now, Otto, the middle-aged man who had complained to Felix over their lunch break about his stomach and his head hurting, was going into kidney failure. And in fact, he was so sick he couldn't come to work anymore and had to get dialysis 3 times a week just to live. And also, another much younger employee, whose name was Elias, he was 26 years old, he had begun having stomach aches. Now, again, that was fairly common at this company, but for Elias, these were not normal stomach aches. These were crippling, severe, like you can't focus on anything else type of stomach aches, similar to the ones Felix was having. Now, Otto and Elias had not spoken to each other about their respective illnesses. This was a place where people just kind of got sick periodically and kept it to themselves. It was just not really that big of a deal. So they hadn't talked to each other, and they certainly had not connected what was happening to them to Felix and his illness, which was now over 2 years before. But that would all change one day in May of 2018, so again, we're still talking about 2 years since Felix went into his coma, when Elias was having his lunch in the company break room, and he would discover something that would connect everything and blow this case wide open. Elias's shocking discovery led police to do a search of a local home. And at first, this home seemed totally ordinary until they went down into the basement. Because down there, it looked like a mad scientist's laboratory. There was this metal table with all these beakers and scales on it, and then behind it were all these shelves that were stacked high with old jam jars and paint cans and even old mayonnaise bottles. And it would turn out, inside of these mismatched containers was a collection of deadly chemicals that a judge would later say were more toxic and more deadly than the literal chemical weapons that were used during World War I. This basement laboratory belonged to Klaus. He was one of the 2 employees that Felix sat with during that very awkward lunch break. The one was Otto, who told Felix he didn't feel very good, and the other was Klaus, the man who, when asked how his day was going, just looked up at Felix, shrugged his shoulders, and said nothing. It would turn out, for years, Klaus had been buying deadly chemicals online, mixing them together, and then sort of testing these concoctions on his coworkers. He would just poison their lunches and see what happened. Felix's very rare disease that only 3 people had experienced in the past century in the whole world was effectively extremely acute mercury poisoning. Basically, an ungodly high level of mercury poisoning. Because Klaus was literally just putting mercury into Felix's cereal, and he was just eating it up. In addition to poisoning Felix's cereal, Klaus also put lead literally right on top of Elias's sandwiches, and then he also put a combination of lead and cadmium into Otto's food. Klaus was only caught because Elias made that big discovery. While he was eating his lunch, he noticed there was a strange powder sitting on top of his sandwich, and so he called the police. Klaus never explained his motives for the poisonings. In March of 2019, he was ultimately sentenced to life in prison. And unfortunately, 10 months after that, Felix, who had been in a vegetative state for 3 years to that point, passed away. As for Elias and Otto, they still suffer from long-term effects of chemical poisoning. On May 27, 2022, an anesthesiologist named Dr. Chad Marsden stood inside of an operating room with a nurse, a surgeon, and their unconscious patient. Dr. Marsden worked at the Baylor Scott & White Surgicare Center in Dallas, Texas, and it was his job to make sure patients stayed asleep during surgery and then woke up safely afterward. That day, Dr. Marsden and his colleagues were wrapping up a routine liposuction procedure on a middle-aged woman. The surgeon had just finished stitching up the woman's incisions, and so Dr. Marsden, following protocol, began taking her slowly off of anesthesia to wake her back up again. And so Dr. Marsden turned off the anesthesia machine, which is this big rectangular device that takes the liquid anesthesia drugs and converts it into a vapor so it can be breathed in. And then Dr. Marsden removed the breathing mask from the woman's face. Then he changed her IV from an anesthetic drug mixture to regular saline. And so now that these drugs were not being pumped into her system, she would wake up over the next half hour or so. After that, Dr. Marsden and the nurse and the surgeon took their patient on the stretcher, and they pushed her out of the OR into the hallway and began making their way down towards the recovery room. But as they were walking down this hallway, they bumped into more of their colleagues, another nurse and another anesthesiologist, and the hallway was tight enough that Dr. Marsden had to step aside to let these two pass. And then after they did, and they sort of waved at their colleagues, Marsden, the nurse, and the surgeon continued walking. And as they did, Marsden happened to look down at their patient, and immediately he knew something was wrong. This woman's skin had turned completely gray. Dr. Marsden was totally caught off guard by this. He looked at her vital sign monitor and saw that her blood pressure, which just moments ago had been normal, was now dangerously high. And then as he's staring at her monitor, her blood pressure plummeted. And then also her oxygen levels fell, and then she began foaming at the mouth. It was clear this woman was going into cardiac arrest, which meant if they didn't act quickly, her heart was going to stop. Now, Dr. Marsden, again, is sort of in shock at how quickly this is happening, but he just jumped into protocol. He began giving the woman chest compressions to make sure blood was flowing to her heart. Meanwhile, the surgeon administered oxygen and blood pressure medication, and the nurse called for an ambulance. The reason she had to call for an ambulance is because the Surgicare Center was not equipped to handle medical emergencies. It was only for scheduled surgeries. And so if there was a medical emergency, all they could do was just stabilize the patient until paramedics arrived. And that's exactly what Dr. Marsden, the nurse, and the surgeon did. They got this woman stable, and then just a minute later, 2 paramedics came running down the hallway. They took possession of the patient, they put her onto their stretcher, out the door they went, they put her in the back of the ambulance, and they sped off to the local hospital. As Dr. Marsden watched the ambulance disappear down the road, he knew his patient was now in good hands, but he was still very shaken by the whole experience. Because this type of emergency, somebody going into unexplained sudden cardiac arrest following a totally routine surgery, was extremely rare. Meaning, for this to happen even just once over the course of somebody's medical career, to have witnessed something like that, was very rare. But for Dr. Marsden, this was not the first time he had seen this. In fact, literally the day before, a different patient at the Surgicare Center had also gone into sudden, unexplained cardiac arrest following their routine procedure. So, as Dr. Marsden went back inside and began heading upstairs to the hospital administrator's office to tell them about this latest emergency, he kept thinking to himself how crazy it was that he had just witnessed these 2 unexplained sudden cardiac arrests basically back to back. But Dr. Marsden just thought to himself, hopefully this is just a really bad coincidence. The Surgicare Center's administrator was a woman named Ashley Burks, and when she heard about this second unexplained cardiac arrest, she knew she had to call a staff meeting. And so that evening, she, along with Dr. Marsden and over 24 other medical staff, doctors, nurses, other anesthesiologists, they met in this conference room in the back of the building. And once everybody was assembled, Ashley began by updating everyone on the 2 patients who had been rushed off to the hospital for their cardiac emergencies, and she said they had stabilized and they'd be okay. But Ashley then said what everybody in the room was thinking, which is sudden unexplained cardiac arrest is so rare, we can't just treat these things like coincidence. Like something specifically must have caused these incidents, and we need to figure out what that thing was. Now, it was possible that the cause or causes behind these incidents were quite simple. Ashley said to the group, the first thing she did was she looked at the two patients' files to see if they had specific drug allergies or medical risk factors that might have been overlooked by staff. But when she looked at their files, neither patient had those risk factors or allergies, so that couldn't have been it. Ashley said she also looked for just a common thread between these two incidents. Like, were the patients doing something similar? Were they in for similar reasons? Were they in the same room? But no, they were in different operating rooms, going through different procedures with different medical teams. And so there was no obvious common thread between the two incidents. So Ashley said to the group that the only reasonable explanation that she could think of, at least at this point, was that perhaps the equipment in the Surgicare Center had malfunctioned. And so what she was going to do, out of an abundance of caution, was just begin testing all of the equipment in the building. And so Ashley told the group that in the meantime, while she was doing that, the rest of the staff should be extra attentive to their patients and also be on the lookout for potential problems with hospital equipment. Ashley watched the medical staff all nod their heads in agreement and begin sort of talking to each other, and then she thanked them all for being there and told them they could leave. 3 weeks later, on the afternoon of June 22nd, Ashley stood outside the OR in the hallway looking through a cabinet that contained surgical drugs. Ashley was still trying to find a connection between those two sudden cardiac arrests. She'd already checked all the Surgicare Center's equipment, from the anesthesia machines to the vital sign monitors to the breathing tubes, and everything was in perfect working condition. And so now, checking these drugs inside of this cabinet was sort of like her last resort. She'd printed out a list of recent drug recalls and was now comparing that list against all of the drugs inside of this cabinet. And so one by one, she was reading a drug and checking the date on it and comparing it with her list to make sure, they were not carrying recalled drugs still. But after going through dozens and dozens of bottles, there was nothing in their cabinet that was on the recall list. So Ashley still just did not have an answer for why those two cardiac emergencies had happened. However, since that staff meeting 3 weeks earlier, the Surgicare Center had not had another cardiac emergency. And so Ashley was thinking to herself, maybe, despite not knowing how this happened, these troubles are in the past. Ashley shut the drug cabinet and walked down the hallway towards the break room to grab her lunch. But the moment she walked inside, she saw a group of her colleagues sitting around a table looking very upset. In fact, some people were visibly crying. And so Ashley walked up to them and said, "Hey, what's going on?" And a nurse told her that one of their colleagues, an anesthesiologist named Dr. Melanie Kaspar, was dead. Apparently, the night before, she had had a heart attack at her home, and her husband had found her and called 911, but unfortunately, by the time paramedics arrived, she was already deceased. Ashley was shocked. She knew Dr. Kaspar, and she knew she was in great shape. She was only in her mid-50s. She did not seem like someone who might just randomly have a heart attack. But then also, Ashley began to think that she remembered hearing in the last few days that Dr. Kaspar had actually been feeling sick. And so she wondered if maybe whatever illness she was suffering from had something to do with her heart attack. Either way, as the Surgicare administrator, it was Ashley's job to plan staff events like memorial services. And so Ashley told the group, hey, I'll get to work putting together a small ceremony for Dr. Kaspar. 5 days later, on June 27th, Ashley was sitting in front of her office computer ordering supplies for Dr. Kaspar's memorial when suddenly she heard these loud, fast footsteps out in the hall as if somebody was sprinting towards her office. And then a moment later, Ashley saw her door burst open and the anesthesiologist, Dr. Chad Marsden, was standing there, and he looked absolutely horrified, and he just said to her, "It's happening again." Ashley's stomach dropped, and she jumped up and sprinted after Dr. Marsden, and they made their way to the hallway outside of the OR. And when they got there, Ashley immediately heard the sound of that long single beep of somebody's heart monitor flatlining, and she looked over and she saw one of the doors to an operating room was open, and inside she saw a surgeon performing chest compressions on an elderly patient. And even from out in the hall, Ashley could tell this man was unconscious, his skin was gray, and he was foaming at the mouth. It was exactly like the other cardiac emergencies that had happened before. Except this time was worse, because that beep, that flatlining beep, meant that this man's heart had actually stopped. And so Ashley just stood there in horror, watching the surgeon perform these chest compressions, knowing that if that didn't work, if they couldn't get this man's heart started again, he was about to die. Just then, Ashley heard the sound of the doors leading into the OR hallway open, and these two paramedics came rushing inside, and right as they passed her and got to the doorway leading into where this man was basically dying, Ashley heard the sound of the flatline beep turn into regular beeping, which meant the surgeon who was doing chest compressions had managed to restart this man's heart. And so Ashley was relieved, but by no means thought they're out of the woods yet. I mean, this man clearly is going through a medical emergency here. But the paramedics got the man off the OR table, they put him on a stretcher, and they wheeled him away. And so once they were gone, Ashley, Dr. Marsden, and the surgeon who had been doing the chest compressions, they all just looked at each other like, what is going on here? Clearly, there is something causing all these sudden cardiac arrests, but still nobody knew what it was. Ashley just stood there for a moment, feeling absolutely sick to her stomach. If it wasn't the drugs, and if it wasn't the medical equipment that caused these sudden cardiac arrests, then what was it? Well, Ashley was determined to find out. Over the next 2 months, Ashley interviewed and observed every single employee of the Surge Care Center to make sure they really were following their protocol absolutely to a T. And one after another, through her research, she discovered that they all were. They were doing exactly what they were supposed to be doing. So the cardiac arrests could not be chalked up to faulty equipment, recalled drugs, or human error. And yet, the cardiac emergencies kept on happening at the Surgicare Center. There were 3 incidents in July and 4 more incidents in the first 3 weeks of August. And so in total, that made 10 patients at the Surgicare Center who had all gone into sudden unexplained cardiac arrest. Now, none of them had died, but Ashley knew a few of them had been left with permanent heart damage. People were getting seriously injured on her watch. And she felt like, she can't figure out what's going on here. And so it's just a matter of time until somebody does die from one of these cardiac emergencies. And so she was feeling completely overwhelmed and stressed out and desperate. Until August 24th, when 2 things happened in quick succession. First, in the morning of August 24th, Ashley received a phone call from an officer at the Dallas Police Department, and they told her that the autopsy had been completed on Dr. Melanie Kaspar, the anesthesiologist who had died back in June from a heart attack at her home. And this police officer thought that Ashley really needed to know that her heart attack had not been natural. It was actually caused by an overdose of a drug called bupivacaine. So Ashley knew what bupivacaine was. It was a drug that was basically only used in surgical anesthesia. But Ashley had never heard of anybody abusing this drug or overdosing on it because bupivacaine does not make you high like morphine or fentanyl does. It's closer to Novocaine. It's like a numbing agent. And so Ashley told the officer how weird it was, the idea that she had died of an overdose of bupivacaine of all drugs. And the officer agreed with her. But regardless, he thought Ashley should know because he thought it was possible that Dr. Kaspar had gotten the bupivacaine from the Surgicare Center. And so feeling totally confused, Ashley thanked the officer for telling her, then they hung up, and then Ashley walked to the OR hallway to check the drug cabinet where drugs like bupivacaine were stored. But as soon as she entered that hallway, the second thing happened that day. Ashley heard chaos break out inside of an operating room where she knew an 18-year-old boy was undergoing what should have been a routine sinus surgery. And so she watched helplessly as the doors flung open and a nurse came running out into the hall to call an ambulance. And then inside the room, Ashley saw an anesthesiologist performing chest compressions on this boy, and another doctor was administering oxygen and blood pressure medication. It was the same nightmare playing out now for an 11th time. But this time, after the EMTs wheeled this boy away to be driven off to the local hospital, Ashley was so desperate to figure out what was going on here that she just couldn't wait. And so she rounded up a couple of hospital staffers that were nearby, and they went into that operating room, and they checked the medical equipment, they checked the drugs that had been used, they searched the floor for anything that might have had something to do with this. I mean, they even searched the trash can. And in the trash, Ashley found something that the second she saw it, it made her blood run cold. She couldn't believe somebody would do something this awful, or why they would do this. And so she took the thing she found in the trash and she ran out of the operating room and upstairs to call the police. Minutes later, 2 police officers arrived at the Surgicare Center and they saw what Ashley had found in the trash. And when When they looked at it, they knew they had a very serious situation on their hands. And so right away, they roped off the operating room where this 18-year-old boy had been, and they began looking for evidence inside of there. And then also, they began reviewing the security camera footage from the OR hallway. And as they reviewed this footage, they would find something truly chilling going on in that hallway that totally explained all of the sudden cardiac arrests that had been happening inside the Surgicare Center. This is what they saw on the clearest piece of footage, which was shot 5 days earlier on August 19th. A hospital employee is seen walking down the OR hallway carrying a stack of papers under his arm. He walks past a couple of his colleagues, and he arrives in front of this big metallic device that sort of looks like a refrigerator, and he opens it up, and he reaches inside, and he pulls out a saline IV bag. Now, when he does this, nobody else in the hallway bats an eye, because this is a totally normal thing to do. That metal device was a warming machine where saline IV bags were stored to be used during or after surgeries. At any given point, this warmer would contain a few dozen IV bags, and whenever it got low, certain staff members would restock it. But the police watched this footage over and over again, and they saw this employee who walks up to the warmer was not just carrying a stack of papers. He was also hiding something within those papers, his own saline IV bag. And so before this man takes out an IV bag from the warmer, he takes this hidden one and places it in the warmer as well. So he's basically swapped one for one. And this was absolutely bizarre because it was not his job to be restocking the warmer. He shouldn't have been putting anything inside of the warmer. And so about 30 minutes after this employee has placed his own IV bag inside of the warmer, a nurse comes out of the OR, walks down the hallway, opens up the warmer, takes one of the warmed up IV bags, carries it down the hall, goes back into the OR, and minutes later, her patient goes into cardiac arrest. It would turn out that nurse had inadvertently grabbed the saline bag that the male employee had secretly placed just minutes before. And she didn't know that that saline bag is what caused the cardiac arrest. Nobody knew until days later when Ashley is so desperate to figure out why all these patients are going into cardiac arrest that she began searching through the trash, and she would find an empty IV bag, and she would see very clearly there was a little puncture on it, just big enough for a needle. And so after seeing this security footage, the police analyzed that empty IV bag that Ashley had found in the trash with the puncture on it to see exactly what was in that IV that went into the 18-year-old who also went into cardiac arrest. And inside, they found a combination of 3 drugs that when combined are like a biological bomb that will send somebody into cardiac arrest within minutes. They were lidocaine, which is an anesthetic, epinephrine, which is basically pure adrenaline, and crucially, the 3rd drug found was bupivacaine, the anesthetic that Dr. Melanie Kaspar had overdosed on, which caused her to die of a heart attack. And this discovery meant that Dr. Kaspar's death was almost certainly connected to these poisoned IV bags. In the few days before Dr. Kaspar's death, she had been feeling sick and dehydrated. And on the day of her death, she was feeling so unwell at work that, unbeknownst to any of her colleagues, she had taken a saline IV bag from that warmer and brought it home with her to rehydrate herself. But unfortunately, the one that she grabbed was one of the poisoned ones. When paramedics arrived at Dr. Kaspar's home, they found her still with the IV needle in her arm. But at the time, nobody connected her death with all of the cardiac emergencies at the Surgicare Center. Well, nobody except for the employee who was actually poisoning the IV bags. That employee was an anesthesiologist, but it was not Dr. Chad Marsden. It was the person that Dr. Marsden had to get out of the way for in the hallway that first time his patient had gone into cardiac arrest. The man who was doing the tampering was Dr. Reynaldo Ortiz. He was 58 years old, and he had only worked at the Surgicare Center for about a year. And he had flown mostly under the radar there until May 19th of 2022, which was about a week before the sudden, unexplained cardiac arrests had begun at the Surgicare Center. On that day, on May 19th, Dr. Ortiz had allowed one of his patients to stop breathing, nearly killing the patient. And so as a result of that incident, Dr. Ortiz had been placed under internal investigation by the Surgicare Center, and he was facing the possibility of losing his medical license because of negligence. So to try to avoid losing his medical license, Dr. Ortiz decided he would just try to make all the other doctors look negligent too, taking the attention off of himself. And so he began sabotaging his colleagues' surgeries by injecting those drugs into their patients' IV bags, knowing it would cause cardiac arrest. Now, none of the patients who went into cardiac arrest at the Surgicare Center died. However, Dr. Kaspar, who took that tampered IV bag home with her, did die. And so ultimately, Dr. Ortiz was responsible for her death. In April of 2024, Dr. Ortiz was found guilty on multiple charges, and he is currently facing a sentence of up to 190 years in prison.
Every window looked temporary. We carried our names like stolen objects, too young to understand permanence. We ran through avenues unfinished by morning, shoelaces untied, lungs full of static air. Billboards melted in puddles beneath us, cities bending under fluorescent rain. Nobody taught us moderation, so we treated night like celebration. Laughing with chipped teeth and restless shadows, as if gravity could be negotiated. There was beauty in our instability, in how nothing stayed symmetrical. Even our mistakes moved like fireworks, violent for a second, unforgettable after. We burned the sky without asking permission.
I need space. I learned to walk alone in rooms full of doubt, turn silence into armor, figure myself out. I don't chase attention, I let it come correct. If love knocks at my door, it better bring respect. I've been breaking patterns that were never mine, healing generations, one boundary at a time. I don't feel losing people who can meet me whole. I'd rather be alone than play a smaller role. I move with soft power, but my mind stays sharp. I love without losing any piece of my heart. I don't beg,
If you don't know this, late last year, we launched a brand new, strange, dark, and mysterious show called MrBallen's Medical Mysteries. And so far, people love it. It is a free weekly show where each week we explore a new baffling mystery originating from